One of the big reasons why there's a stigma associated with mental health is because the only people who reach the mental health care system are those who have hit rock bottom. Whereas if we built a system that met people every year of life like our annual physicals, like in physical care does, then it suddenly wouldn't be something associated with crisis or something associated with rock bottom. So really to change it, it's not about slapping a cute brand on it, it's about changing the experience itself. I'm Ariela Safira, the founder and CEO of Real. I'm 26 years old and I'm on a mission to improve mental health care. Real is a new kind of mental health care company. My vision was and still is to build a mental health practice that people engage in regularly. This should be an experience and something you take part in every day and you think of every day. It is not a doctor's appointment, right? It is not a one-time experience. It is a part of your everyday life. And whether that's a one-on-one therapy appointment, a group experience, an event, different channels and avenues for you to understand yourself from the comfort of your own home. David Kelly, given his background in design of spaces, taught me about what does the physical space of a rehab or an inpatient mental health facility, what is that physical space supposed to be doing for patients, and what is it actually doing today? These physical spaces were missing heart, warmth, care, right? And so really what we need to do is we need to bring safety and care to those facilities, and that doesn't currently exist.
Ariela, tell me a little bit about your family.
I grew up with parents who are immigrants. My mother was born and raised in Poland. My father is a Yemeni Jew born and raised in Israel. Both of them came here in their 20s. And my older brother was sort of a third parent for me. Arthur, he's 4 years my senior.
You were a disruptor early on. You were the only girl on your high school's wrestling team.
Being the only girl on the grappling team meant I was, from a young age, very comfortable being different. I think I was motivated even by standing out a bit and knew that the only way I could comfortably do so was if I excelled at the sport, and certainly sought to do that.
Something happened when you were a freshman at Stanford that was extremely upsetting.
A friend of mine attempted to take her own life. It was certainly the first time I'd ever experienced something so traumatic. I hadn't heard from her for a few weeks, received an email that shared what had happened and that she was currently in rehab. The first time she'd ever seen a mental health clinician was when she had attempted to take her life. I think very quickly I'd thought, imagine if the first time someone saw a primary care physician was when they had cancer, right? It was very clear to me, this system is failing us if people aren't even meeting the system until crisis. It didn't start as a mission to start a company, of course. It started as, I guess, curiosity and even more so like shame and frustration over what the system currently looks like, and slowly ended up spending my entirety of Stanford exploring it.
What kinds of things did you do, Ariela, to better understand the mental health care system that really was representative of what it was like across the country?
I applied to tens of grants to visit rehabs throughout the country, inpatient mental health facilities. I interviewed architects who designed inpatient mental health facilities, really to learn why do we make the decisions in mental health care that we make. I then spent 3 months working in Liverpool, England, at what's considered the most innovative mental ward in the world, to learn what do they do that's so innovative and how can we bring that with us here to the US. And the most innovative step they really took was being more proactive.
You're 24, you're trying to get investors. Was it hard to get people who got your vision?
Of course, there were many investors who didn't get it, who didn't understand that we can ever live in a country where everyone practiced mental health, and probably didn't understand that a 24-year-old would get the country there. The lead investor in my first round was Anu Dugal, the founder of Female Founders Fund, and was the first person to immediately believe in and cling on to Real. I want mental health care to be a part of overall life. I mean, I even think that it should be a part of our family systems. It should be integrated in how we go about every day, and that's what I aim to do for this country. Disrupting, to me, really means taking 10 steps back and asking, what is this system that I'm looking at? Who is it supposed to serve? And if it's not actually serving that community right now, how can I improve it?